Hello, everyone. Thank you for tuning in. I'm Aline Sigler. I'm with Provider Outreach and Education. Joining me today is my friend and coworker, Mary Muko. You'll see her monitoring the chat and adding some links and other helpful information for you. I want to thank her for her help today. Today, we're talking about our interactive voice response, or IVR system. This webinar is part of a series on the IVR. If you missed any of our previous sessions, you want to catch up on those, you can find them on our YouTube channel and the Encore presentations page of our website. It'll be on our website for a limited time, so you'll want to check that out. We created this education based on survey responses from our provider community. So from you and your colleagues. We review those surveys daily, and we take the responses very seriously, and we look for ways to improve not only our education, but your overall customer experience. We want to improve your knowledge and your overall satisfaction with WPS as your claims processing contractor. I'd like to tell you a little bit about our training center. The training center of our website is where we post the event materials for webinars like the one today, and we usually have those out there about a week or 5 days in advance. So if you want to download a copy of any of our slide decks, you can find it on our website. So let's go there real quick and take a look at our training center. For those of you who are new to Medicare, new to WPS, or just new to our website, just a little bit about our live events page. So when you click on live events, this is also where you find out about upcoming courses that we're doing. And to register, you're going to click on the time. See how the time is an active link for those courses. Then if we go back, I also want to make you aware that we have our Encore presentations page. I mentioned that we're recording this webinar, and we record all of our webinars, and unless there's something wrong with the audio, you'll find it here. So when you click on Encore presentations, you see a list of recent events. Now, depending on the number of events that we do, they will normally be available for 60 to 90 days. If I just open one here, you'll notice, and it takes just a little bit of a second to download, but there's a player embedded in our website where you can watch these previous webinars that we've done. This is really helpful for those of you who aren't allowed to go to YouTube on your work computer or during work hours. You can still watch the education here. And then something else that you may not be aware of is we also offer the materials, a copy of the slide deck here in the lower left corner. And then we also would love to have your feedback about those Encore presentations. And there is down in the lower right corner a way to leave your feedback after watching any of these events. So I wanted to just take a second to make you aware of that, because some of you may not even know that those things existed. So just wanted to share that with you. I'm going to go back to our PowerPoint now. The questions, the chat, where Mary's been adding a couple things for us already this morning. This is where you can put any questions that you have that are related to our topic today. We will take questions at the end of our prepared remarks as we have time. And then whether you're listening live or you're listening to the Encore, the recording, we hope you'll take the opportunity to give us your feedback about this course by taking the survey. Like I said, those surveys give us insight into how we're doing and the types of education that you want and need. Our next slide is our disclaimer. And among other things, it lets you know that the information that we're providing is as accurate and complete to the best of our knowledge. So we do our very best. As a government program, though, Medicare does change, so make sure that you're looking at the federal regulations because they will take priority over anything that's presented today. And then this note here on the side in this picture, there's no need to record or screenshot any of our education because we do record it for you and we give you a copy of the slide deck. So we don't allow that, and especially not for profit-making purposes. The next 3 slides contain acronyms, and these are ones that I specifically used in the creation of this PowerPoint or that I know I'm going to be mentioning during this webinar. Medicare is full of acronyms, so we want to take the time to define them for you when we first use them. But putting them here on these slides also gives you an opportunity to look back and see exactly what they mean as a resource without having to spell each one of these out on every slide that we use them on. So we are always going to give you resources where you can get more information, and this is part of that. Especially for those of you who might be new to Medicare. Nothing is called by its real name. There's usually an acronym. So what are we going to talk about this morning? During our time together, what we're going to do is define what the IVR is and what it can do. We're going to examine what information you need to have ready before you can use it. I'll share some tips for using the IVR, and we're going to review certain functions that the IVR contains. And then at the end of our program, we'll explore where you can find more information. Again, giving you those resources where you can read more about it, learn more about it as you go forward. Now, some of this might be a review if you've attended some of our earlier events, but we do have people registered for this event who were not on the earlier events. So some of this may be a review. We also don't know if the people who view the encores will view them in the same order. So we just want to make sure each one of these webinars can stand alone, and so you will see a little bit of a repeat in some of this preliminary information. Now, as the name states, the IVR is voice activated, but users can also use their touch-tone telephone keypad to interact with it as well. Right now, among other things, users can obtain eligibility, claim status, payments, information about overpayments, remittance advice, and overlapping claims. There's more to it than that, but that is a sample of what the IVR can provide. There are some unique features for Part A providers that bill on the UB04 or the 837I electronic equivalent, and Part B providers who bill professional claims on the CMS 1500 or 837P. Some of our previous sessions were for both provider types, but this one is specific for the options for Part A providers. If you're requesting information other than a general question, the IVR does require you to authenticate your identity before being able to access certain claim, beneficiary, or provider-specific details. And this is for safety reasons. You will be required to provide certain elements before you can go any further within the system. This slide outlines those required elements as they relate to a provider. So we begin with a valid NPI, PTAN, and tax identification number combination. Those three things, as they pertain to a provider, are important. Now, certain NPIs have more than one PTAN and tax identification number associated with them. So that combination there needs to sync up or match before the system will actually recognize you as an official provider and therefore user. You're only required to say or enter the last 5 digits of your tax identification number, but the system will require you to say or enter your entire PTAN and NPI. So be prepared for that. That's our first tip. You should also plan to have a remittance advice handy, just in case in those certain situations that you're transferred to a representative. They may ask you to authenticate items from that remittance advice, again, in another step to make sure that you are who you say you are and that you are entitled to the information that you're asking for. Now, on the flip side of that, the required information as it pertains to beneficiary elements, for certain inquiries, there are things that you will be required to provide. You'll need the beneficiary's name as it appears on their Medicare card. And as it appears on their Medicare card is important because we all know people who go by nicknames, shortened versions of their names. They may go by their middle name or something like that. So this may be different than what you know the patient as or how they're registered in your system. If it doesn't match what Social Security has, because patients sign up for Medicare through Social Security, then you might get wrong information, or it may say that it can't find your patient or it can't find the information that you're looking for. If you're using the keypad to enter the name, you'll enter numerical equivalents for the first 6 letters of the last name and the first initial of their first name. We need the patient's Medicare number, known as their Medicare Beneficiary Identifier, or MBI. Now, this is also on their red, white, and blue Medicare card. Depending on what you're looking for, the IVR may require the patient's date of birth and the date of service in question, depending on, again, what you're hoping to get from the IVR in return. Other items that you'll need to successfully use the IVR are a telephone with a handset or a headset. And the reason for this is that they will pick up your voice the best and help to not capture any background noise that you don't intend for the system to hear. Now, you may have used a speakerphone or a cell phone and had it work just fine. The only way that or the reason that we recommend this is because technology is different, equipment is different, some speakers are more sensitive than others, and so, for first-time users, we do recommend a telephone with a handset or a headset. You also want to try to be in a quiet environment. You know your environment best. So if you work in an office setting or you work in at the registration desk at a facility or a provider's office, it's hard to predict when someone's going to pop in or the other phones are going to ring or equipment's going to make noise, those kinds of things. So try to be in a quiet environment. That'll give you the best results, especially if using your voice activation. Consider having our IVR operating guide open. You can reference this if you need it. It does give you step-by-step instructions on how to enter certain information and how to navigate the menus. You do want to make sure that you have the correct one because we have some capabilities that are unique for Part A versus Part B. And so in order to alleviate any confusion, you want to make sure that you have the right one open. Some of the prompts are different for those unique situations. I do suggest bookmarking the page that has our user guide on it. We'll go out and we'll look at that in just a minute. Instead of downloading it and saving it to your desktop or even printing it out, because it does get updated, and by going to our website directly, you'll always have the most up-to-date version. The same goes for what we have called our IVR conversion tools or chart. You can bookmark that page also once I show it to you. This way, if you want the system to help you in converting alphabetic data into numeric format for entering into the IVR with your phone keypad, it will show you how to do that. And again, we'll look at those a little bit later in the presentation. When you first dial in, the IVR is going to give you some preliminary messages. These are things like brief announcements, current issues that we have, when the next customer service training closure is scheduled for. It also gives you instructions for accessing a survey at the end of your call to give us feedback about your IVR experience. Those opening messages can change sometimes. You know, sometimes CMS gives us special announcements that we need to share with providers. So it depends on the situation and direction from CMS. After those preliminary messages, then the system's going to give you its initial prompt, and it's going to say something like, in a few words, please tell me why you're calling. For best results, you want your responses, your verbal responses, to be short, yet provide enough details to route your call correctly. An example would be, I want to check overlapping claims, or I'm calling about a claim denial. The IVR uses natural language understanding, which allows for a more conversational experience. And in this way, you're not solely limited to predefined terms or touch tone options. And when you take a look at the IVR guide, it does give you some suggestions, but instead you can speak freely, as if you were just talking to a person. So now at this point, then, the system is going to ask you to speak or enter that combination of your NPI, PTAN, and your tax identification number. If you're going to be entering them with your telephone keypad, this is where the conversion tool or chart will come in handy. And then after you've authenticated with those items, the system will proceed with prompts related to what you've asked for. In our earlier sessions, we've talked about the claim status, checks, overpayments, and question functions, and those pertain to both Part A and Part B providers. So as I mentioned, this segment or this webinar focuses on some of those topics that are specific for Part A providers, and this slide shows the self-service main menu options that we're going to be covering. We'll talk about them in the same order as they're listed on the menu and in the guide. So we'll go over claim information, credit balance, discharge status, and remittance advice. I've also listed the corresponding keypad options here, and know that even if the system doesn't state the touch tone options during those initial prompts, you can say or key the equivalent value anytime. It's whatever you prefer. I want to explain also a little bit about how this presentation is built. So when we talk about each of these, first we're going to go over what information is required for each function. Then we'll review the details that the IVR will provide. And then if there are additional requests you can make after getting the details, we'll then cover those as well. So starting off with claim information. Within the claim information menu selection, there are 3 different sub-selections, and you see them listed here. We covered claim status during another event, So today we're going to talk about overlapping claims and appeals in this session. So we're going to start with overlapping claims. To get information about overlapping claims, the IVR is going to ask you for the patient's Medicare number, first and last name, and the start and end dates of service. It's also going to ask for the document control number, often called the DCN of your claim. The IVR will take that data and compare it to other claims in the system that might be causing your claim to reject or suspend with the reason code because of an overlap situation. So then this slide shows the details that you'll receive. It'll have the number of claims, the type of claim it is, and the other provider's name and address. This can help you if you need to contact that other facility and discuss the situation or claims that need to be corrected, theirs or yours. If multiple claims are available for the dates you entered, the IVR repeats the information for each claim. After you receive the overlapping claim information, then you have other requests you can make. You have the option of changing the service date, changing the Medicare number, investigating a different claim number, or changing your provider details. So this will let you check multiple requests about overlapping claims without leaving your session, having to dial back in, re-authenticate, and go through that whole process. So moving on to our next function, which is option number 3 under claims information, and that's to check appeal status. You'll need to enter or state the MBI, the patient's first and last name, and the dates of service. Now remember, if you're entering the patient's name using your touch-tone telephone keypad, you only need the first 6 digits of the last name and the first initial of the first name. Just a reminder there. You'll also need the dates of service. And then once you do that, the IVR is going to respond with the number of appeals for that date of service, which of the 5 levels of appeal the claim is currently in, the status of the appeal, and by that I mean whether it's open, closed, or reopened. It will also give you the date the appeal was received, and if it applies to your claim, the date of the decision. The IVR is also going to provide the details, and these are the ones that you see here. The appeal disposition, if it's closed, that could be favorable, partially favorable, unfavorable, misrouted, dismissed, or unspecified. It will tell you the Medicare Appeals System, or MAS number. Now that's something that you might not be as familiar with, but each appeal is assigned a number, and that can help you. And then it'll give you the claim number or the DCN. If multiple appeals are available for the dates, the IVR is going to repeat that information for each appeal. And then after you receive those details, if there are multiple appeals for the dates of service, you can change the PTAN or you can change the NPI to continue checking appeal status. Next up is credit balance, and this is the next unique Part A feature that we're going to look at today. Credit balance reports are due quarterly. If this isn't something that is associated with your job at your facility, this may sound a little foreign to you, but a credit balance report is required on a quarterly basis, So what you're going to need then is to let the IVR know which fiscal year and quarter you want to check on. The system will tell you if the credit balance report has been received, and if it has, the IVR is going to respond with the receipt date and the method in which it was received. Providers are encouraged to submit their credit balance reports in our provider portal, but they can also be mailed or faxed. If multiple credit balance reports are available for that fiscal year quarter, the IVR repeats that information for each one. If you need to check multiple credit balance reports, you have the option of changing the date, meaning you could change the quarter that you're looking at, or you could enter a different NPI or PTAN. IVR users who want to check discharge status are going to need the elements that you see listed here: the patient's first and last name, date of birth, and their Medicare number. You'll also need to say or enter a beginning and ending dates of service. The IVR is going to take that information and look for claims on the patient's master record on what we call the common working file. It's going to be looking for claims that fall within that date range that you've provided. And then just a quick tip here: if you have a claim billed within the date range that you're checking, make sure you authenticate using that NPI-PTAN tax ID combination. So this lets the system know to ignore your claim or claims in its response. So instead of checking all of the patient's claims, it's going to take yours out of the mix. So once you do that, the IVR's response for the discharge status is specifically going to be for the type of discharge, meaning inpatient, hospice, home health, or no discharge record found. If it's inpatient, it's going to give you the inpatient facility type. So if that's the case, that's what you'll hear. Note that the system only indicates discharge to the facility types that are listed here. The IVR will not indicate discharge to home if no home health or hospice details are available. So if the patient left a facility, was discharged to home, you won't see that or hear that, listed in the IVR. All right, it seems like my system's caught up now. So once you get that discharge status information, you can say repeat that. If you want to start over, you can say main menu. If the IVR prompts you by saying, tell me another patient's Medicare number, then at that point you can say or enter another patient's MBI. Then the last function of the IVR that we're going to examine in this Part A session is remittance advice. To get information about a remittance advice, you're going to need the date of the remit. If one exists, the system will begin to give details such as are shown here. This isn't an all-inclusive list, so I couldn't fit everything on the slide here, but you can view the entire list in the Part A IVR operating guide. Some of the highlights are the remittance number, the remittance check amount, could be EFT, but it's listed as check amount, and claim payment. If you're a PIP provider, meaning you receive periodic interim payments, and one is listed or included on this remit, then the IVR will tell you the PIP amount. If you're a teaching facility, you'll hear about the direct medical education payment, and also if you're getting any accelerated payments. So just to reiterate here, this is not an all-inclusive list, and it may not pertain to every provider. It's just a few examples of the types of information that the IVR will return. You'll also hear information about other payment details like settlements, payment for kidney acquisition, bad debts, refunds, or those associated with Section 935, which is the limitation on recoupment of overpayments. So some other things that, payment details that your remittance advice may on occasion contain. Along with lots of payment details, you'll also hear about withholdings that may apply to you. And this slide has some examples. So claim withholdings, accelerated payments, penalty, settlement, offset, accounts receivable, withholdings from affiliated providers, and overpayments based on that 935 process once that recoupment limit has elapsed. And then after you've heard the information from your remittance advice, then you have other requests you can make. You can again say, repeat that, get another remittance, and then enter or say the date to check another RA for the same provider. You can switch it up and change the NPI or the PTAN. And finally then, anytime you want to start over within the IVR, you can say main menu. I hope reviewing these functions of the IVR gave you some insight into what more this self-service option can do to assist you, your facility or your office. I do want to share a couple additional pointers with you. These are things that in our surveys and through our earlier education, we've found out that providers don't necessarily know about. And the first one is you don't have to wait for the entire prompt to play. If you know where you want to go and what you want to do, you can go ahead and key or speak your selection at any time. And this is where the guide can really help you until you become more accustomed to the IVR navigation. Using that guide, you'll be able to see what to expect or what's coming next. If the IVR says you can say additional information, that usually means that there is more data associated with and available for your request. If the IVR is having trouble recognizing what you say, enter the information using your telephone keypad instead. You can switch between functions in almost all situations. And then finally, I think I mentioned this before, you'll not hear the touch tone options during those initial prompts, but know that you can say or enter the equivalent numeric value anytime. So now I want to take a look at how to find some of the items that I've mentioned. So first we're going to go out to the WPS website, and I did link the screenshot on this slide, and I do that for a couple reasons. If our website were to be down for maintenance or something like that, any kind of disruption, I wanted to give you a visual of some of the places that we're going to go to. So later, if you're looking at the slides or you're sharing this information with someone else, this will give you a clue as to where we're going to go once we get to our website. So give me just a second here to link out to our website. And I've already been out here today, so I've selected J8 MAC Part A. The only thing I want to remind you about is if you're a Part A provider, make sure you go to the Part A section of the website to find your guide. The same with our Part B providers because the guides are different. So you'll notice over here in our quick links on the right that we have a quick link to the IVR conversion tool that we've talked about. So that is a great way to get to that. The only thing that I want to just put a bug in your ear about is that depending on how many things we have in our quick links, if something were to be added that would take priority, some of these items, since we only have so much real estate here, may move off of the quick links. So I also want to show you how to navigate to these things. So up in the topic center, in the drop-down, we're going to choose self-service because the IVR is a self-service tool. So that brings us to the guides and resources page. And you notice right at the top here, so that'll give you a clue as to how often these things are used. We have an article about natural language and the IVR. And then we also have a quick link here to our operating guide. You'll notice that it's also over here on the right in the contact information. So multiple ways to get to the same information. Also, you can scroll down on the guides and resources page. We have a section dedicated to interactive voice response. And if I expand that, you see that those same two resources, the natural language article and the operating guide, are available there as well. Again, if something else were to take precedence up here at the top, you know that you can find them here. I'm going to select the operating guide. Again, we're talking about the Part A options, and so that's the one, the page that we're on. And you can see it's divided into sections or chapters or topics. So you see them all listed here. You also have the opportunity to download the whole thing if you want to search for a particular term or something like that. It's really what your preference is. This is the page that I would recommend you bookmarking so that you can come back to it, although all the ways that I showed you how to find it is very quick. So what I want to choose first is the section called Entering Data. The Entering Data section is the conversion tool that I was talking about. So here's the conversion tool for the beneficiary's name. Here's the conversion tool for PTANs and MBIs. Since CMS moved away from Social Security number-based Medicare numbers, it's a random combination of letters and numbers, and so this is handy for you. I also mentioned the conversion chart. So if you are a cheat sheet person, here's the chart that I was talking about. It also gives you some tips and reminders on how to use these tools most effectively and efficiently for yourself. So I'm just going to, as an example, use my last name, which is exactly 6 letters. Remember I said if you're going to be entering it using your keypad, you only have to enter the first 6 digits and then the first initial of the first name. So if I was your patient, it displays the numbers that you're going to enter using your keypad to find claims or eligibility or whatever it is in the IVR for your patient. So I wanted to show you how to find that and how to use that. I'm going to back up here. I'm going to go back to the menu here. And I mentioned that the remittance advice details are more than what were included on the slide. So if I select that section or that chapter, you see it listed here, you can get the whole list of information that the IVR will display depending on what is on the particular remittance advice that you are asking about. All right, I'm going to go back to our PowerPoint now. I'm always a little bit nervous when I switch between resources when I'm sharing my screen, but it seemed to work for us, so that's great. I'm going to go to the next slide. So here's a list of those resources that we just looked at. If you downloaded a copy of the presentation, you have these live links because we're actually giving you a PowerPoint, not a PDF. So you can get to all those. I showed you the operating guide. I showed you how to find the conversion tools and how those worked. I mentioned the natural language article. Now this top resource is from the CMS Internet-Only Manuals. It's 100-9, and it's Chapter 6, Provider Customer Service Program. And within that, there is, let's just jump out there real quick. Hope I didn't jinx myself by doing that. Within that manual and that section, I'm going to scroll here, so look away if that bothers your eyes. Down here in section 50, you can jump right to that. PSS stands for Provider Self-Service. So here are the regulations where CMS tells all MACs that they have to have provider self-service tools. What those tools are, you can see the IVR is listed. And then the very next section, section 50.1, are the requirements for the IVR. And all MACs and all providers have to abide by these regulations. So again, just a place where you can get more information about what we're talking about. And so if you're just learning about Medicare, just learning about what tools are available for you and how to use the IVR, that will give you some background information. So, you know, where does this information come from and why do we do what we do and how we do it? So I wanted to share that with you. Next is a special announcement for you. CMS released change request 13754. If you haven't seen it yet, I will ask Mary to add a link to the chat if she hasn't already. So right now, users can still obtain beneficiary eligibility in the IVR, but CMS is or has directed MACs to disable that eligibility information and remove it from their IVR systems. Now, the change request states that this has to be done by March 31st of 2025, and then it's up to the MACs to determine when they will do that. WPS has settled on a date to remove this option of January 1st, 2025. And that is an update to what's on the slide in your handout, so you may want to pencil it in or make a note of it. It says by March 31st, but for WPS providers, it will be removed January 1st, 2025. Now, the reason for this is CMS's commitment to protecting beneficiaries from Medicare fraud. This is part of that effort. The CR does go on to state that this is a pilot program involving most MACs, and then CMS will monitor the impact that this change makes, and they'll evaluate if that eligibility information will be reinstated or become permanently discontinued. This slide also lists other self-service options that you have to check eligibility once that January 1st date comes in. We have the Secure Net Access Portal, or SNAP, which is the secure side of the WPS website. It was just redesigned for better functionality and efficiency, so that is, and it's completely free also. We have planned educational sessions coming up about this, so if you're interested in learning more. As a Part A provider, you also have the ability to check eligibility in direct data entry, or DDE, which is part of the Fiscal Intermediary Standard System. You may already have this if you have DDE and you didn't even realize it. So you can check with your systems department or your vendor to find out more about that. We have a DDE user manual, and we also are planning some educational events about this option. And then finally, the third option here, as you see, is the HIPAA Eligibility Transaction System, or HETS. That can also provide beneficiary information that you need. If you want to check with your vendor about that too, you might already have this as part of your billing software and didn't realize it either. And then we also have a link to that change request so that you can read more about that. So special announcement, something fairly recent, something that's coming down the pike, but just want to make you aware of that. So now I'm going to check in with Mary. I want to see if you have any questions related to this topic. When I'm sharing my screen and sharing the PowerPoint, I can't see the chat. So Mary, have we had any questions?
Hi, Aline. We have had one question, and the question is this: can you obtain the status of your credit balance submitted?
Yes, you can. That's a good question. So you'll want to look at your IVR guide, and it'll walk you through step by step how to check the status of your credit balance report. That's a good question.
That is the only question so far, Aline.
All right. Well, thank you so much, Mary. I want to thank you again for being my co-host today. In a few minutes, after we're done here, you're going to receive an email. And in addition to me thanking you personally for attending today, this email is going to do just that also. It's going to contain also your certificate of achievement. It'll look similar to what we have on the right side of the slide here, and I've circled it to draw your attention to it, because if you're not used to looking at those emails, you might think that it's just blah, blah, blah follow-up material. If you are interested in continuing education units, this has your contact hours. So save this email if you're going to need it. It'll have the name of the course, the date, your name, and your contact hours. It also is going to give you a link to the survey. So if, depending on your preference, another way to jump out to the survey and give us your feedback about our education. Next, if you think of a question after we end today, you do have a week to send those in to us. You can use our same education mailbox right here. We have it listed here. Put something about the IVR or IVR Essentials in the subject line. Those emails then will be directed directly to me. I'll put them together. I'll provide answers. I'll send them out to everybody that's in attendance today. If you have specific questions about a claim that you've billed, you can send those to customer service. They have access to the system. They can look at those with you and advise you on next steps. So again, if you have a question, you have a week to send those in, and we will get an answer for you. Please, please, please take a few minutes to complete a survey about this course. Let us know how likely you are to attend other courses that we may provide. Would you recommend our education to other people? We want to know what you liked, what we could do better. We know there's always room for improvement. And then give us suggestions for future education. You have a few options depending on your preference. You can use the link in the chat. You can, when you exit the webinar, when we close out for the day, you'll be asked to go to an external site. That external site is the Qualtrics site for the CMS survey about this course. It will look similar to this box on the right here with the triangle and the blue continue button. So this is just to let you know that we want your feedback, and this will take you directly to that survey. If you click the blue continue button, it's not malicious, it's not spam, we're not taking you somewhere dangerous or compromising. It is for the survey. If you're listening to the encore or the recording of this live event, a box will appear that looks like this box here with the hand and the stars, and this will be a link where you can take the survey on that recording. You can also scroll down in the description if you're watching our encore on YouTube. If you're watching on our website with the player that we have embedded, look in the lower right corner. That will also give you an option to take the survey. So those surveys actually give us insight into how we're doing, and more importantly, the types of education that you want and you need. On behalf of myself, Mary, and all of us in Provider Outreach and Education, I want to thank you for your participation today. We hope to have you join us for future education, and we look forward to your survey feedback. Thank you so much. Have a good rest of your day, and you can now disconnect.